Here's something most people won't tell you about your money in 2026, and I've spent enough years watching how systems work to know when numbers hide bigger truths. Your Social Security check is getting a 2.8% increase this January. Sounds reasonable until you actually do the arithmetic. That's $56 more per month for the average retiree. Now, before you start planning how to spend it, Medicare Part B premiums are jumping nearly $18 monthly, consuming almost a third of that increase before you even see it. But here's where it gets genuinely interesting and frankly disturbing. There are over 2.7 million Americans aged 62 and older carrying student loan debt right now. When those loans default, and hundreds of thousands have, the government can legally take up to 15% of your Social Security benefit to collect. Not through some complicated legal process requiring judges and courtrooms, they just take it, administratively. 1 month you're getting your full check, the next month 15% vanishes. The law protects you down to $750 monthly, but think about what that means. If you're living on modest benefits and already struggling, you could be losing nearly $200 every single month to old student debt. What bothers me most isn't just the policy, it's how few people understand it's happening. Between 2001 and 2019, the number of Social Security recipients losing benefits to student loans increased by over 3,000%. That's not a typo, 3,000%. We're talking about people who borrowed for education decades ago, watched interest compound, and now face retirement with both inadequate savings and the government reaching into their Social Security checks. The average person losing benefits this way sees about $186 taken monthly. For someone dependent on Social Security for 90% of their income, that's not an inconvenience. That's a crisis involving food, medicine, and housing decisions. Let me walk you through why this matters more than the headlines suggest. You see, the 2.8% COLA for 2026 sounds like the government doing something responsible, adjusting benefits for inflation. But when you actually examine the mechanics of how this plays out in real life, you discover a kind of institutional dishonesty that would make any clear-thinking person uncomfortable. The average Social Security check right now sits around $2,015 monthly. With the increase, that becomes $2,071, $56 more. Now here's what they don't emphasize in the press releases. Medicare Part B premiums are jumping from $185 to $202.90 per month. That's an increase of $17.90, which immediately consumes nearly 32% of your COLA before you see a dime. Your effective increase isn't $56, it's closer to $38. And we haven't even discussed the Medicare Part B deductible, which climbed from $257 to $283, or the Part A deductible that jumped to $1,736. These aren't small numbers when you're living on a fixed income. The arithmetic here reveals something important about how systems actually work versus how they're presented. When politicians talk about protecting seniors with cost of living adjustments, they're technically correct. Benefits did increase, but the lived experience for millions of people is that their purchasing power barely budged, and for many it actually declined. This is what I call institutional complexity hiding simple truth. The system is designed so that multiple agencies, Social Security Administration, Centers for Medicare and Medicaid Services, Treasury Department, all operate independently with their own mandates and formulas. Nobody is technically lying, but the net result for the person receiving benefits can be devastating. It's like watching three honest referees call a game where each one only sees their piece of the field, and the player ends up losing despite everyone following the rules. Now let's talk about the student loan situation, because this is where the story gets genuinely dark. Most Americans have no idea that the federal government has been garnishing Social Security checks to collect student debt. They don't know because it wasn't widely publicized, and frankly it sounds so contrary to the spirit of Social Security that people assume it can't be true. But it is true, and it's been happening for decades. Between 2001 and 2019, the number of older Americans having their Social Security benefits garnished for student loans grew by more than 3,000%. Read that again, 3,000% increase. We went from about 6,200 people in 2001 to over 192,000 in 2019. These aren't rounding errors or statistical anomalies. These are hundreds of thousands of real people, mostly in their 60s, 70s, and 80s, watching the government take money from their retirement checks to pay off student loans they took out decades ago. Here's how the mechanics work and why it's so pernicious. When you default on federal student loans, which happens after 9 months of non-payment, the Department of Education refers your case to the Treasury Offset Program. Through this program, the government can administratively garnish up to 15% of your Social Security benefit. There's no court hearing, no judge, no opportunity to plead your case in the moment. The reduction just happens. 1 month you get your full check, the next month 15% disappears. The law does provide one protection. Your benefits cannot be reduced below $750 per month. That sounds reasonable until you realize that $750 monthly equals $9,000 annually, which is well below the federal poverty level of $15,650 for a single person. So the law's protection is essentially meaningless. It allows the government to push you into poverty. Think about what this means in practice. If you're receiving the average Social Security benefit of about $1,976 monthly and you default on student loans, the government can take up to $296 each month. For someone who depends on Social Security for 90% of their income, and remember, approximately 47% of unmarried Social Security recipients rely on it for 90% or more of their income, losing nearly $300 monthly is catastrophic. That's food, that's medication. That's the difference between keeping the heat on in winter or wearing extra sweaters. The data shows that the average amount garnished is around $186 monthly, which lines up pretty close to that 15% figure. Over a year, that's $2,232 gone. What makes this particularly cruel is the composition of these debts. Most of the older Americans facing garnishment borrowed relatively small amounts, often for their own education decades ago. Government Accountability Office data shows that about 73% of older borrowers subject to offset took loans only for themselves, not for children or grandchildren. Most owed less than $10,000 at the time their benefits started being garnished. But because of how interest compounds and because of the fees the government tax on, collection costs, administrative charges, the balances grew over time. The Consumer Financial Protection Bureau found that nearly 3/4 of the money collected through these offsets goes to accumulated interest and collection fees, not to the principal loan amount. So people are paying and paying, often for decades, and barely making a dent in what they actually borrowed. It's a debt trap by design. Here's another piece of the puzzle that makes this system particularly insidious. Many of these older borrowers didn't even know they were eligible for income-driven repayment plans that could have prevented default in the first place. If you're living on Social Security as your only income and you enroll in an income-driven plan, your monthly payment would typically be $0. Let me say that clearly, $0. The formulas for these plans exclude a certain amount of income to cover basic needs, and Social Security benefits for most people fall below that threshold. But the system doesn't automatically enroll you in these plans. You have to know they exist, you have to navigate the application process, and you have to keep up with annual recertification. For someone in their 70s who maybe doesn't have internet access or who finds bureaucratic forms confusing, these barriers are real and consequential. During the COVID-19 pandemic, collections on defaulted student loans were paused. For 5 years, people got a reprieve. Benefits stopped being garnished. No wage garnishments, no tax refund seizures. It was temporary relief, but for 500,000 older Americans, it made an enormous difference in their quality of life. Then in May of 2025, the current administration announced that collections would resume. By June, notices went out to approximately 195,000 Social Security recipients, warning that garnishment would begin. And it did. After a 5-year pause, hundreds of thousands of older Americans saw their checks shrink again. The government characterized this as restoring accountability to the student loan system. But accountability to whom? We're talking about people who borrowed money for education, often in amounts that seem almost quaint by today's standards, and who've been paying on those loans for 20, 30, sometimes 40 years. The broader context here matters. As of the first quarter of 2025, approximately 2.9 million Americans aged 62 and older carry student loan debt. That number has increased 71% since 2017. Why? Some borrowed late in life for career changes or additional education. Some co-signed loans for children or grandchildren. Some have been in repayment for decades and the debt just never went away because of interest accumulation. And now for those who've defaulted, nearly 500,000 are facing or at risk of benefit garnishment. The trajectory is clear and disturbing. More older Americans carrying student debt, more defaults as people struggle financially, more garnishment of benefits that were supposed to provide basic security in retirement. Now, you might reasonably ask, what can someone do if they're facing this situation? There are options, though none of them are easy. First, if you're in default, you can rehabilitate your loans. This requires making 9 consecutive on-time monthly payments. The payment amount is calculated as 15% of your discretionary income, basically income above 150% of the federal poverty line for your household size. If that's still too much, you can request an alternative payment amount based on your actual expenses. The advantage of rehabilitation is that once completed, the default notation is removed from your credit report. The disadvantage is it takes at least 9 months, and if you default again, you traditionally could only rehabilitate once. However, new rules starting in 2027 will allow a second rehabilitation, which is something. Second option, loan consolidation. You can consolidate your defaulted loans into a new direct consolidation loan, which immediately gets you out of default status. The catch is that outstanding interest gets added to your principal balance, so you're essentially capitalizing all that accumulated interest. Also, it restarts the clock on any forgiveness programs you might be working toward. But consolidation can be faster than rehabilitation, sometimes just a few weeks. And once consolidated, you can enroll in an income-driven repayment plan. If your only income is Social Security, that income-driven payment would likely be zero. Third option, enroll in an income-driven repayment plan before you default. This is preventive, not reactive, but it's worth understanding. There are several income-driven plans: income-based repayment, pay-as-you-earn, income-contingent repayment, and they all calculate your payment based on your income and family size. For most people whose sole income is Social Security, the payment works out to zero or close to it. You still have to recertify annually, which means paperwork, but it keeps you in good standing and protects you from garnishment. The challenge is that the student loan repayment landscape is changing dramatically. Recent legislation passed in 2025 is phasing out several existing plans and creating a new one called the Repayment Assistance Plan that will be the primary income-driven option going forward. The details are complex and still being worked out through regulations, but the core point remains. If you're on Social Security and that's your only income, an income-driven plan likely means a $0 monthly payment. Here's what troubles me most about this entire situation. We have two massive federal systems, Social Security and student loans, operating with completely different philosophies and timelines. Social Security was created as a social insurance program, a safety net to prevent elderly poverty. The idea was that people would pay into the system during their working years and then receive benefits in retirement that would provide basic economic security. Student loans, on the other hand, are treated as commercial debts despite being government-backed. The collection mechanisms are aggressive: wage garnishment, tax refund seizure, benefit offsets. There's no statute of limitations on federal student loans. The debt never goes away. And these two systems collide when someone who borrowed for education decades ago finds themselves in retirement with unpaid student debt. The government becomes both the benefit provider and the debt collector, taking money from one pocket to satisfy the other. The policy question is whether this makes sense. Does it serve the public interest to reduce Social Security benefits specifically designed to prevent poverty among the elderly, to collect on old student loans where most of the money goes to interest and fees? The amount of money we're talking about collecting is relatively small in the grand scheme of federal finances. In fiscal year 2019, the government collected roughly $138 million through Social Security offsets for student loans. That sounds like a lot until you realize the total outstanding federal student loan portfolio is over $1.6 trillion. The offset collections represent less than 0.01% of that portfolio. Meanwhile, the human cost is substantial. People choosing between food and medicine, people unable to afford heating in winter, people falling deeper into poverty specifically because the government is garnishing their poverty prevention benefits. There's a deeper principle here about how we structure incentives and consequences in society. Student loans are supposed to be investments in human capital. The premise is that education increases earning potential, which allows people to repay their loans while enjoying higher lifetime income. That's the theory. The reality is messier. Some people borrow for education that doesn't pan out. Some face health problems or job losses that derail their careers. Some make poor choices, sure, but many are simply unlucky in ways that compound over time. And when we get to retirement age and someone still has unpaid student debt, we have to ask, what's the point of continued aggressive collection? The person's earning years are over, their income is fixed. Taking 15% of their Social Security doesn't rehabilitate their financial situation. It just makes their final years more difficult. If I were designing this system from scratch, I'd say that once someone reaches full retirement age and is collecting Social Security, any remaining student loan debt should either be forgiven or moved to an income-driven plan with payments calculated on income, excluding Social Security benefits. The argument against this is moral hazard. People might deliberately not pay expecting forgiveness at retirement age. But that argument doesn't hold up when you look at who's actually being garnished. These are people who've been paying or trying to pay for decades. They're not strategic defaulters gaming the system. They're people who borrowed when they were young, life happened, debt accumulated, and now they're old and poor. Continuing to garnish their poverty-level benefits serves no one's interest, except perhaps some abstract notion of debt accountability that ignores the human reality. The situation in 2026 requires both immediate practical action and longer-term systemic reform. If you're someone facing benefit garnishment, contact your loan servicer immediately and ask about income-driven repayment plans. Don't wait for the garnishment to start. If you're already in default, look into rehabilitation or consolidation. Yes, it's bureaucratic and confusing, but the alternative, losing 15% of your Social Security indefinitely, is worse. If you know someone in this situation, help them navigate the system. Sometimes all it takes is someone to sit down, make the phone calls, and fill out the forms. And if you're concerned about this as a policy issue, make noise about it. Write to your representatives. Support legislation that would protect Social Security benefits from student loan garnishment. The system won't change unless people understand what's happening and demand different priorities. What we're witnessing in 2026 is a collision of good intentions, bad design, and inadequate oversight. Social Security COLA increases that get eaten by Medicare premium hikes. Student loan garnishments that push elderly Americans deeper into poverty. Systems that work on paper but fail in practice. None of this is inevitable. These are policy choices, and different choices are possible. The first step is seeing clearly what's actually happening, not what we're told is happening. The second step is deciding whether we're comfortable with a system that reduces poverty prevention benefits to collect on old education debts. And the third step is having the political will to fix it. That's the work ahead, and it matters more than most people realize.